Welcome back to another CANVax webinar. Since fall 2019, we've been hosting webinars exploring current and emerging immunization topics to assist Canadian public health professionals seeking evidence-based information that supports the planning, promotion, and acceptance of vaccination programs. To learn more, please visit our website at canvax.ca/webinars as indicated in the link you see on the screen. Today's webinar, How to Use Motivational Interviewing in Conversations of Patients Who Are Vaccine Hesitant, is brought to you by the Canadian Public Health Association through the CANVax Project. I'm Antonella Pucci. I'm a CANVax Project Officer with CPHA, and I'll be introducing this webinar. Also assisting me on the Q&A portion of the webinar is my colleague Aishwarya Shah, who is also a Project Officer for CANVax. But before we begin, we want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. As for a bit of housekeeping, it should be noted that all attendees are muted. For this webinar, the Q&A feature located on your toolbar will be used to ask questions. If you have any questions, please type them in the Q&A box. You can do so at any point during the webinar. Only you, myself, and the presenter can see your questions in the My Questions section. And when asking a question to the presenter, the question is first read out loud, then answered live by the presenter, and then posted in our All Questions section. If you do encounter any technical difficulties, please contact D. McPherson at cpha.ca, and we will reply to you as soon as we can. If multiple people are experiencing the same problem, we'll address it live via a broadcast message in the chat. As for some quick notes, it should be noted that this webinar is being recorded and will be made live on CPHA's YouTube channel and on canvax.ca, and presentation slides will also be shared. We invite you to also take a short 5-minute post-evaluation survey at the end of this presentation to provide your feedback in the delivery of this webinar. And finally, if you haven't already registered with CANVax or subscribed to our newsletter, you can visit canvax.ca today to do so. So with that, let's begin. We have the pleasure of welcoming back Dr. Arnaud Gagneur to present today's webinar on how to use motivational interviewing in conversations of patients who are vaccine hesitant. Dr. Gagneur is a full professor in the Faculty of Medicine and Health Sciences at the University of Sherbrooke. He is also a senior clinician scientist at the CIU SSS de Leicester CHU Research Center. He obtained his medical degree at Lille University and completed his pediatric residency and his neonatology training, as well as his PhD in virology at the University of Brest in France. Dr. Gagneur has developed and validated the concept of promoting vaccination to parents and maternity wards of hospitals through motivational interviewing techniques. The PromoVac strategy consisted of a pilot study in Eastern Quebec townships. In collaboration with the Quebec Ministry of Health, he participated in the implementation of the PromoVac strategy as a provincial public health program entitled the EMI program. Dr. Gagneur's research team developed training and evaluation tools for health professionals on how to apply motivational interviewing in their practice and in their conversations of patients who are vaccine hesitant. In addition, Dr. Gagneur participates in the European Center for Disease Prevention and Control's expert group on vaccine acceptance, and he is also collaborating with UNICEF and the US CDC to develop training in motivational interviewing for healthcare workers. So with that, I'd like to turn it over to our speaker, Dr. Arnaud Gagneur. You can start sharing your screen.
Thank you, Antonella, and hello to everyone. I'm very happy to be here and to have this CANVax webinar on how to use motivational interviewing and how could we use motivational interviewing to increase vaccine acceptance. So I'm going to share my screen. So first of all, I have no conflict of interest to declare. And just before begin this webinar, I just want you to ask yourself, imagine you are faced with an ambivalent person about the COVID-19 vaccine, and what would you spontaneously reply to this person who's going to tell you, oh, there's nothing reassuring about what I read on the internet. I'm not that. Again, I get there at some point. The fact is the vaccine was developed quickly, and I can't quite trust it. So just take 10 seconds. What do you spontaneously reply to this person? And we're going to see if at the end of this webinar, you will have the same answer. So now we are going to look at what are the main challenges for healthcare providers in vaccine hesitancy. And one of the main challenges is what I call the information paradox. Because we have seen in literature like the traditional educational approach to give more information, give more facts on education alone, do not change belief or behavior in vaccination. And worse, it could be ineffective, and worse, it could backfire and reinforce vaccine hesitancy. But on the other side, when you ask, for example, parents, what do you need for communication about routine childhood immunization? Parents say we wanted more information than we receive. So what's the problem? On one side, to give information doesn't work, but on the other side, when you ask people what they want more information. But maybe the problem is not to give information, but it's how we give information to people, because people want information balanced between benefits and harms. They want information presented clearly and simply and tailored to their situation in a good time. So maybe the challenge is to provide adapted factual information on vaccination to parents and to people. And we're going to see how motivational interviewing approach could help us to reach this point, to what information to give to the people and how to give this information to people. The second challenge is sometimes the problem is us. It is us as healthcare provider who generate resistance. And how? Because very often as clinicians, we want to restore our patient problem. It is called the writing reflex. You should do that. I'm the expert and I'm going to tell you what to do. But when a person doesn't feel listened or doesn't feel understood, when they're frightened to act, to think is threatened, the relationship could become a struggle. And we have all experience with hesitant people to feel this struggle, this battle in the relationship. Other problem is that there is only one type of vaccine hesitancy. Vaccine hesitancy, it's a continuum. There is a continuum of vaccine acceptance between people who refuse all the vaccine and people to accept all the vaccine. And so we should adapt the goal of our intervention according to this level of hesitancy. And for the more people are aware to accept vaccination, the more we could move to the planification of the vaccine with those people. But the more they are hesitant, the goal of our intervention could only be to have an open discussion about immunization and try to see how we could move towards a more positive position for immunization and not going to planify the vaccine because we're going to generate resistance. Could the people change? It is very important to know what allows people to change. There is three main pillars for people to be able to change. Is to be confident on in own abilities to change. It is also to make the change because it's a deliberate choice, and we want to make a change because we think that is very important to make this change. And according to the immunization and vaccination, we have seen that to reinforce the importance of immunization and vaccination, it is the main pillar to go through to increase vaccine acceptance. Also, how we could help people to change. We should be aware that the change is a step-by-step process. And for people who are very hesitant, who don't want to vaccinate, who don't trust vaccinations, that don't think it is important, we should be aware that they couldn't move directly towards a very strong position in favor of immunization. So we should help them to move step by step to decrease their hesitancy and to increase the feeling of the importance of vaccination, because if you want to go too fast toward the decision of immunization, we always going to generate resistance. And finally, it is very important to know why the patient is hesitant. And literature, there is a lot of review of literature that have demonstrated all the determinant of vaccine hesitancy. The main determinant is the risk of vaccine, the fears of side effects, but there is also other determinant of the perceived necessity of the vaccine, the vulnerability to the disease, the benefit of vaccines, the distrust in public health authority. But it is at a population level, but we are not faced with the population. We are faced with one people. And so for these people, it is important to know what is its own problem, its own determinant of vaccine hesitancy. Maybe for these people, the main problem is the distrust in public health authority. And we have seen that with COVID-19, that is a major problem, the distrust in public health authority. And if you lose your time to speak about the vulnerability to the disease, you lose your time because it's not the problem of the people. The problem is the distrust in public health authority with the perceived necessity of vaccine. So we should target what is the specific determinant of vaccine hesitancy of these people. And maybe for another people, it will be completely different determinant of vaccine hesitancy. So it is very important to know what are the good information to give to these people and not to give all the same information to every people. So what are the main challenges for healthcare providers? We have seen that to give more and more information in a directive way does not work, and it generates resistance. And as a healthcare provider, we should adapt to the specific needs of the patient in order to help and support them in their decision to vaccinate. And how we should adapt the goal of our intervention according to the patient level of vaccine hesitancy. Also, we should adapt to the patient's ability to change. It is very important to avoid resistance and discord, and one of the first aim in the intervention is to establish a trustful relationship. And when we are in resistance and discord, we couldn't establish this trustful relationship. And also, it is very important to find which information are relevant to this specific patient and which information will reinforce its perception of the importance of vaccination. So now, is it possible to do that? And first, the bad news is there is no magical intervention that fits all his needs, and there is no one intervention. So we should adapt to every patient, and we should adapt our intervention to every patient. And we're going to see how motivational interviewing could help us to reach this target. Motivational interviewing was developed first 30 years ago by Miller and Rolnick. They were psychologists, and they developed motivational interviewing in the domain of toxicomany, tobacco, because they have seen that if you tell somebody don't take drugs, it's not good for you, it's bad for you and your family, and to judge them and to give them some advice and to tell them what to do, it doesn't work. But if you adapt a very empathetical approach in a partnership, try to help people at the level that they are, with no judgment, and try to reinforce their own motivation to change and their ability to change, it works better and they have very better results. And so motivational interviewing is based on 3 pillars. It is the spirit of motivational interviewing, to be in a partnership with the people, to be in a judgmental position of acceptance of the position of the patient, and to be in a compassion of altruism and want to help the people where he is. It is also based on 4 processes, and the first process is to engage in the relationship and to try to establish a trustful relationship before going to the planification of the change of the behavior. And it's also based on 5 skills that are open question to be able to target specifically what are the needs of the patient, to use reflex listening, valorization, to show empathy to the people, and also to use specific techniques of sharing information, that is elicit, share, elicit, or ask, offer, ask. Always ask permission before give some information to the people, and we are going to have some example at the end of the presentation. So now we're going to see what is the effectiveness of motivational interviewing in vaccine hesitancy. So I'm going to just briefly show you the summary of the PromoVax studies that we have conducted for the 10 last years in Quebec and Canada. And what is the PromoVax strategy? The PromoVax strategy was based on the fact that there is lots of delays in first vaccine, and we have seen that they were associated with delayed of incomplete vaccine schedules in childhood. And as the first vaccine is at 2 months of age, we need an early vaccination promotion strategy. And as there is a failure of traditional educational or information strategy, we try to use a motivational interviewing approach to meet the needs of the parents. So the PromoVax strategy is to provide to parents an educational intervention at birth using a motivational interviewing approach in order to increase vaccine acceptance. So we first conducted a cohort regional studies in Eastern townships, and we have seen that with these single interventions that was 15 to 20 minutes intervention in maternity wards with vaccination counselor, we have seen that the proportion of parents that have a strong intention to vaccinate their child, after the intervention, it increased by 15%, the proportion of parents who want to vaccinate their child. And we follow the cohort of infants that parents receive the intervention in maternity wards, and we're able to demonstrate it that if parents receive the intervention, the infants have 9% more chance to have a complete vaccination schedules during the 0 to 2 years without delay. So we conducted a randomized controlled trial in the province of Quebec, and we observed same results with an increase of parental vaccine intentions of 12%. And we also add in this study the parental vaccine hesitancy score developed by Douglas Opel in the US. And we're able to demonstrate that after the intervention, the score decreased by 40% for the parents that received the intervention. And more interestingly, this score allows us to classify the level of hesitation. A score less than 30 is a low level of hesitancy. 30 to 50, it's an intermediate level of hesitancy, and more than 50, it's a high level of hesitancy. And we have seen that in our sample of population, 16% of the population has a high level of hesitancy before the intervention. And after the intervention, there is only less 5% of the parents who are still a very high level of hesitancy. So the intervention is also very effective with very hesitant parents. So these good results leads to the Ministry of Health to implement the PromoVax strategy into a provincial public health program. So that is the AMI program, AMI for Entretien Motivationnel en Maternité pour l'Immunisation des Enfants. And the philosophy of the program is to offer to all parents during the stay maternity wards an open exchange on vaccination to support their decision in order to provide the best protection for the child and increasing vaccine coverage for all infant children. So we evaluate the first phase of this program, and we're able to demonstrate that we observe the same results in real life that the results you observed in previous study in Quebec. So we have a significant increase in vaccine intention in parents who receive the intervention during the program. We have also a significant decrease of vaccine hesitancy score. We also observe a high impact of parents with very high level of hesitancy. and divided by 2 the proportion of parents who still have a very high level of hesitancy after receiving the intervention. We also observe an impact on vaccine coverage, comparing region where the program was implemented and region where the program was not implemented, with a significant increase in vaccine coverage in region where the program were implemented. And we also observe comparing in region where the program was a significant increase comparing parents who receive or not the program. So an increase of vaccine intention, a decrease of vaccine hesitancy, and an increase of vaccine uptake was observed during the first years of implementation of the program. And finally, very interestingly, we observe a very high level of satisfaction of parents who receive the program. 94% of parents appreciate to participate in the program. And very interestingly, 97% of parents said that the discussion respects their point of view. So it's a very good indicator of the quality of use of motivational interviewing during those educational sessions at birth. So now I want you to share with you what is motivational interviewing in practice. So I'm going to show you a video of a real intervention in maternity wards with real parents that are not actors. It's a real intervention. It is Loic's parents. They doesn't want to vaccinate him before the age of 2 years. They are a very high level of hesitancy, not against vaccination, but against the time of vaccination. And so it's we are going to see the first 3 minutes of interaction of the counselor with the parents. So I just share the video now.
Bon, bonjour maman, bonjour papa, bonjour. Merci beaucoup de m'accueillir. Hein. Donc, je suis Arnaud, donc je suis conseiller en vaccination. Puis mon rôle, un petit peu là, c'est d'avoir une discussion sur la vaccination avec vous, puis de répondre à vos questions. Je suis avant tout là pour répondre à vos questions. Et donc, je vais commencer par une première question. Vous en pensez quoi de la vaccination? Est-ce que vous avez envisagé la vaccination de Loïc? C'est quoi votre position par rapport à la vaccination?
Ben oui, j'ai envisagé la vaccination. Ouais. Je trouve que la vaccination se fait trop jeune.
Ouais.
Mais sinon, je viens de faire vacciner mon fils de 2 ans.
D'accord, ok.
C'est ça.
D'accord, donc ce que je comprends là, c'est ça, que vous pensez que la vaccination c'est important,
ouais.
Mais peut-être une crainte par rapport à quel age on fait la vaccination. Ouais. Est-ce qu'il faut vraiment faire la vaccination à cet âge-là ou à quel âge on doit la faire? D'accord, on pourra l'aborder si vous voulez, hein, c'est bien important. Donc vous avez envisagé de vacciner Loïc, mais un peu plus tard, si je comprends bien, c'est ça? Bon, parfait. Est-ce que dans la vaccination, vous avez certaines questions par rapport à c'est quoi la maladie contre lesquelles on protège? C'est quoi les vaccins qu'on donne? Est-ce que vous avez des questions spécifiques un petit peu?
Ben, les vaccins en soi ne me dérangent pas. Ouais. C'est vraiment l'âge à laquelle on est dans.
D'accord. Donc c'est vraiment...
Je les ai toutes données je viens juste de les faire. C'est vraiment...
D'accord. Okay.
Ça fait 1 mois que je les ai faites. Là,
OK.
C'est une question aussi d'anticorps que l'enfant il est jeune, les anticorps ne sont pas tous développés.
D'accord.
C'est une crainte qu'on nous autres on a.
Ouais.
OK, parfait.
J'envoie pas mes enfants en garderie.
Ouais.
Qui restent pas mal chez nous.
Ouais.
Puis j'allaite jusqu'à 18 mois.
D'accord.
Fait que tu sais...
OK, donc à ce moment-là, vous pensez qu'ils sont moins susceptibles d'avoir des maladies parce que comme ils sont à la maison puis vous allaitez, ça les protège aussi, c'est ça?
Oui.
D'accord. Donc c'est vrai que vous avez raison, parce que le mode de vie, l'exposition aux maladies change en fonction du mode de vie aussi, bien sûr. Hein, c'est vrai que la garderie les expose à beaucoup plus de maladies. Et puis l'allaitement, on sait que ça protège aussi, et ça donne des anticorps de la maman aussi au bébé. Hein, donc tout ça, c'est des bonnes stratégies pour protéger le bébé. Donc à ce moment-là, est-ce que ça vous intéresse un petit peu qu'on parle un petit peu, parce que vous parlez d'anticorps, de voir un peu comment ça fonctionne un vaccin, comment ça fonctionne l'immunité, comment ça fonctionne un vaccin.
Ouais.
Ouais. On va peut-être commencer par ça, puis comme ça on verra un petit peu pourquoi on vaccine. Alors qu'est-ce que vous...
What have we seen in this video, and how can we summarize this in my approach? First, at the beginning of the intervention, the aim of the intervention is to establish a relationship of trust. So according to in my spirit, we should be in an accepting position of the hesitation of the parents. We should not judge parents, and we should be curious about their belief and their position. And very, very important, we should not try to correct misinformation at first. Never, as I have said to the mother, breastfeeding is good, but it's not enough. We should avoid the but yes, you want to protect him by breastfeed, it's very good. And don't try at the beginning to convince her to give more arguments. We should also let people express their fears, their concerns. So we should be in a very position of listening, of reflective listening. And you could have seen that I've made lots of complex reflection. Okay, so if I well understand, you want to say that, okay, you are thinking that vaccination is important, but you have some concern about the age to give the vaccine. Okay, we're going to avoid it. And not starting, but it's very important to start at 2 months. No, it's not the time to do that. And it's very important to express empathy to the people. Empathy is showing to people that we understand them and we want to help them. And empathy is the most effective way to move towards change. A second aim of the beginning of the intervention is to trying to understand the specific determinant of the person hesitation. So to use open-ended question to make complete reflex and to be able to target what will be the specific relevant information that I could provide to this person to increase the perception of the importance of vaccination. And for this example of parents in maternity wards, it is very important to try to understand why they think it's better to starting vaccination at 2 months. And it was very important to target that the main concern of the parents was starting vaccination too early. And I asked some question about disease, and I asked some question about vaccine, but the real problem of the parents is, okay, no, it's too young. Okay, so after that, we are aware that we should go to this problem. We should solve this problem with the parents. And it's not, we have not time to speak to other problem with those parents. It not be effective. So we should forget of the specific needs of those parents. So only when we have established the trustful relationship, only when we have target what are the specific determinant of the hesitation of the people, we could start to give some information that's going to be relevant for these parents, and information that we could give because we have established a trustful relationship. So now we are going to see how we could give some information with parents. So I'm going to follow the vidéo.
Vous avez compris du fonctionnement d'un vaccin. Qu'est-ce que vous, papa me parlait d'anticorps. Qu'est-ce que vous avez compris un peu de...
Moi, je pense qu'il injecte le médicament sans le noyau. Ouais. Pas le médicament, la bactérie sans noyau.
Ouais.
Puis là, ton corps crée des anticorps face à...
Ouais. Ah, c'est bien. C'est
ça que j'ai compris.
Ouais, c'est ça. Est-ce que vous connaissez le terme d'antigène? Moi, d'accord. On connaît l'anticorps, d'accord. Bon, c'est ça, donc vous avez raison. Donc il y a des microbes, on va appeler ça des microbes, donc des bactéries, des virus, des fois des champignons aussi, mais c'est surtout des bactéries et des virus qui causent les maladies. Et puis effectivement, vous avez raison, donc ces bactéries, ces virus, il y a différentes parties, et à la surface des virus ou des bactéries, on a ce qu'on appelle des antigènes. Donc c'est des petites molécules qui sont reconnus par le système immunitaire. Ces antigènes-là, ils vont entraîner la production par le système immunitaire d'anticorps. Puis c'est ce qu'on appelle les soldats, quand on parle d'immunité, on parle toujours des petits soldats, les anticorps. Et donc c'est ces anticorps-là qui vont protéger contre les maladies. Donc pour s'immuniser, donc on a deux façons de s'immuniser pour produire l'anticorps. Soit on a la bactérie ou le virus qui pénètre dans notre organisme, puis à ce moment-là, le système immunitaire reconnaît les antigènes, fabrique des anticorps, puis une fois qu'il a fabriqué les anticorps, ça va détruire les bactéries et les virus, puis on est guéri. Le problème de ça, c'est que si la bactérie ou le virus il est très méchant, bah, des fois on est très très malade ou des fois on meurt avant d'avoir des anticorps. Ouais. Hein, c'est le principe. Et donc le principe de la vaccination, c'est de mettre dans l'organisme les antigènes, donc ce qui est à la surface du microbe ou de la bactérie, mais sans, alors vous parliez du noyau, donc c'est vrai que le noyau, puis sans toutes les autres parties du microbe ou de la bactérie qui causent la maladie. Simplement l'antigène qui est responsable de la fabrication des anticorps. On fabrique des anticorps, on n'est pas malade, et quand on ingère, on est contaminé par la bactérie ou le virus, bah, nos anticorps vont aller se fixer sur les antigènes à la surface de la bactérie ou du virus, puis ça va neutraliser la bactérie ou le virus, puis on n'est pas malade. Donc c'est ça le principe un peu de la vaccination et de l'immunisation. Est-ce que ça fait du sens pour vous?
Oui, mais dans le fond, on pourrait quand même pogner la maladie. Bon, on peut pogner la maladie, c'est juste qu'elle va être moins forte.
Alors, non, parce qu'en fin de compte, les anticorps ils vont agir avant que les microbes puissent développer la maladie. C'est vraiment ça, c'est vraiment ça le principe de la vaccination. Ils sont là tout de suite, ils sont présents tout de suite. Que quand on fait la maladie, bah, pour fabriquer des anticorps, il faut plusieurs jours. C'est pas instantané, ça se fait pas en une seconde. Donc, bah, on a le temps d'être malade. Tandis que quand on est vacciné, il y a des cellules mémoire qui sont activées. Ces cellules mémoire, dès que le bactérie ou la virus rentre, elles sont activées, et puis hop, ça sécrète les anticorps tout de suite. Et donc ça empêche d'être malade à ce moment-là. C'est comme ça ça empêche la maladie.
C'est direct.
Ouais.
Parce qu'ils sont déjà là.
Oui, ils sont déjà là.
Au lieu d'attendre qu'ils se développent.
Voilà. Parce que sinon, il faut plusieurs jours pour que les anticorps se développent. Hein. Puis ça dépend après selon quel virus, quelle bactérie. Des fois, c'est 2-3 jours, des fois, c'est 2 semaines. Donc, c'est plus ou moins long. Mais que quand on est vacciné, bah, ils sont disponibles tout de suite. Donc, c'est ça l'avantage, en fin de compte. Ouais. Donc, maintenant, on va peut-être venir, si vous voulez, à la question qui vous taraude. Je sens qu'il y a quelque chose là qui est... Pourquoi on vaccine à 1 an, à 2 ans, à 2 mois, etc. Okay. Donc, qu'est-ce que vous savez un petit peu de cette réponse immunitaire et de la maturation de ce système immunitaire?
À 2 mois, on n'a pas de système immunitaire. Notre système immunitaire commence ou avant 2 mois, il n'y en a pas. À 2 mois, je pense qu'il commence. Puis il y a un différent, je pense que c'est différent vitamines.
So, we have here a good example of how to share some information with people. And yes, so when we have established the trustful relationship, we are able to give some information to the patient because he is agreed to receive information because you are not in a fighting position, you are not in resistance. So it's very important to first establish a trustful relationship. And to give some information is very important to use the ask, offer, ask. Always ask permission before to give information. And a good way to give some information is to arouse curiosity of the people and to starting with their own knowledge on the situation and trying to co-building a new knowledge in a partnership with the people that will increase the perception of the importance of vaccinations. So specifically for those parents, it was very important starting to move with them to reinforce the importance to vaccinate before the age of 2 years. So it was important to make them aware of how the immune system works and after how the immune system was developed. So you have seen the first part, how the immune system works, and after there is a second part of delivering information, so on the maturation of the immune system. And I very like a sentence of philosopher Spinoza that told us very long time ago that you could only change a belief or a thought by something that makes more sense than the belief to be changed. So it's very important to starting with the own knowledge of the people. It's also very important. I'm sorry for this. I don't know how to move. It's also very important to respect the autonomy of the person and to say to the person, it's your decision. And I am confident that you will do the best thing and the best choice for your child. Very often, parents and people feel that they are very judged because of their hesitation. They are very judged because they don't want to receive the vaccine. And it's very, very important to respect the autonomy. And lots of studies in motivational interviewing have shown that the two main pillars that could allow a person to change, it is the empathy and the respect of the autonomy. And the more you respect the autonomy of the people, the more is able to change. It looks like counterintuitive, but it works very well to respect the autonomy of the people. And so I hope with those examples, you have a practice example of how to use EMI. And I just want to share with you an interview of a mother that have a preterm newborn in my unit. And she was an Antivaxx mother who didn't want to vaccinate him. And I made an intervention with this mother. And she changed her mind, and she decided to vaccinate the child. And this mother was interviewed by a journalist who came in Sherbrooke to see the AME program and also the Promovac approach. And what the mother said to the journalist is that the doctors said to me that he's worried about when vaccinated my child, but he didn't press me to make a decision. The doctor told her, I leave you think about it. Thank you for speaking with me. That fed forward into her. Once it was done, the doctor told her, whether you choose to vaccinate or choose your child, I respect your decision as someone who wants the best for your kids. And the mother said that just that sentence, to me, it was all the gold in the world. And she changes his mind because she didn't feel judged, and she feels that the autonomy was respect. So what are the next steps now with motivational interviewing approach in vaccine hesitancy? So the AME program now is going on in all maternity wards across the province of Quebec, and we are also starting very, very far region in Quebec, making those interventions by Zoom platform, and we have evaluated those interventions that works also very well. We have conducted some Promovac pilot study in France to try to demonstrate that this kind of approach could be used in the several different cultural settings. We have made, in collaboration with UNICEF, training for healthcare providers in motivational interviewing in immunization in Romania. We have also developed with US CDC modules training package on a phone application for applying EMI techniques to support peer-to-peer vaccine conversation in the population. And we have also developed a collaboration with the Faculty of Medicine of Marseille to integrating an EMI training and immunization into family physician resident curriculum. And we are also starting 2 pilot projects in Marseille and also in Guyane and France. We have a collaboration with Santé Publique France to train a street social worker and also mediators in motivational interviewing to try to increase COVID vaccine acceptance in the population. And finally, in Canada, we are starting the Mikkovac pilot project. The project was funded by the Public Health Agency of Canada, by the Immunization Partnership Funds. We are going to make some virtual interventions through Zoom platform with the hesitant population that has not been vaccinated, and with parents we are reluctant to vaccinate the child. This project receives support from CANVax, and thank you to Antonella and Greg and Ashwaya to help us with this project. So people could booking appointments on the CANVax website. We will train 15 immunization consultants that will receive a training in immunization and also in motivational interviewing. And so this vaccination counselor will make intervention from April to September. So and I invite you as healthcare provider to offer to your hesitant patient to refer them to the CANVax website so they can make an appointment with a counselor to receive an intervention to try to increase COVID vaccine acceptance. So thank you so much for your intention. And now, if you are looking at the first question that I have at the beginning of my presentation, what do you respond to this person, ambivalent person, who asks you this kind of question against COVID-19 vaccine? So thank you so much for your intention, and I will be happy to answer to your question now.
Thank you, Arnaud, for a wonderful presentation. So at this point, if you have questions, please submit them using the Q&A feature. As a reminder to everyone, you can also submit your questions anonymously. Any questions that are answered live will appear in your Q&A window under the All Questions tab. So while we're waiting for questions to come in, I believe that throughout the presentation, a few of the participants already put in their questions in the Q&A box. So the first question is, what might be some ideas on how our immunization partnership can meet with vaccine-resistant persons and healthcare providers?
So, okay. Okay, so what might be some ideas on how our immunization partnership could meet with vaccine-resistant person and healthcare workers? Okay, so what do you mean exactly from immunization partnership?
I think they also asked a follow-up question to that as well. So we're using college-age students as part of our vaccine partnership group. They're interested in ideas other than websites to present their message on the importance of vaccines. Do you have any ideas on other media platforms like TikTok or podcasts that would appeal to younger people?
Yeah, it's a there is two ways of trying to increase vaccine acceptance in the population. Yes, social media and to share some information and try to correct misinformation is very important. But it's our experience using a motivational interviewing approach is with very hesitant people, an individualized approach, with a face-to-face approach, with a discussion with the person could allow us to go in a deeper process to understand what is a specific needs, what is a specific determinant of vaccine hesitancy, and to give him the specific information that he needs to move towards a more positive position for immunization. It is important to correct misinformation on social media. It is important to give the right information on social media, but it's don't allow us to meet the specific target the specific needs of the population. So it could be a complementary approach to spread good messages, good information, to share good information about, for example, COVID-19 vaccine and the burden of the disease. But also, it could be complementary to have this approach with motivational interviewing with very hesitant people to try to understand what are the real concerns and what is the specific information that they need to bring to meet their expectation.
Okay. So our next question is regarding the ME program. So the participant has asked, it would be helpful to know what level of vax hesitancy were these participants who changed to becoming accepting of vaccines. Maybe it was mentioned already in the presentation, but it may have missed it. So yeah, so that's a question, is regarding what was helpful to know was the level of vaccine hesitancy and how they became accepting of vaccines.
Yeah, it's a very good question. And what we have seen in the PromoVac strategy and also in the ME program, it is possible with very high level of hesitancy to make change for these people, or even with a single intervention. The response of the very hesitant parents was first thank you. Even they don't change their mind for vaccination, but they said thank you because it is the first time that I met a healthcare worker that didn't judge me, that didn't tell me I should do that without nothing else, no another possibility to do something. And so they said thank you for that, because it's the first time I feel listening, I feel understood, I don't feel judged. And with that, it's decrease the level of reactance. It decreases the level of anger. It allows to establish a trustful relationship. So it allows to have an open discussion with the counselor that was not possible before because they feel anger and they feel not understood. So it's the first point. The second point that we observe that we were able with half to 70% of parents with high level hesitancy to move them towards a decision of immunization. So it's a very powerful tool with hesitant people to move them towards the direction of vaccination. I personally experience those kind of intervention with very hesitant people to receive the COVID-19 vaccine. And of course, at the end of the intervention, people didn't say to me, okay, I will receive the vaccine, because I respect their autonomy and I just say, oh, thanks so much to have this discussion. And very often, 1 week, 2 weeks later, I receive email, text on my phone with people sending me a picture. Ah, look, I have my appointment. Or look, it is my arm with my little patch on my arm. I received the vaccine. So it's very important to respect the way of change step by step, and to respect the autonomy of the people, and don't want to have a person in front of us that said, okay, I will do. No, just you're going to think about that and I will respect your decision. But it's very powerful with very hesitant patients.
Oh yeah, definitely lots of good information. So our next question is the 11 module training package for peer-to-peer vaccine conversations available publicly through CDC? And if so, what is it called?
It's a pilot project ongoing, so it's not yet available in Canada, and we want to test it in the field. So, but I am pretty sure that when it will be validated, it could be available, and it will be very interesting to share with everyone. But it is still in the validation phase, so it's not yet available.
Okay, all right. So our next question is, okay, so the Mikkovac pilot project is sounds fantastic. I would love to get some more info on how to make referrals. So I believe this information was provided throughout the presentation. It's on canvax.ca/Mikkovac. And the second question was, can it be offered in French as well for parents? I believe they're referring to the Mikkovac project.
Yeah. Mikkovac project is to train vaccination counselor in all provinces in Canada to offer intervention to parents. So there is a vaccination counselor who will provide intervention in English, but also there will be vaccination counselor who provide session in French. So we are going to have both a counselor able to make intervention in French or in English, and it will be available for everyone in Canada to receive an intervention.
Okay. So the next question is, are there scripts available for good opening questions to start the dialogue and establish trust?
It's a good question. As I said, there is no single magic way of doing. What is very important is to be very open to the patient and trying to be the more larger as possible with global open question to let the people express himself his concern about immunization, what is his real concern. And so the more larger you are, I think the good is the more it is more good. And trying to, after that, to ask some question to define more precisely what are the concerns of the people. So at the beginning, you have seen in the intervention maternity wards, I just asked question about what do you want to know about disease, about vaccine, what do you think about it? What do you think about vaccination, immunization? So it is a mother that said, oh, okay, vaccines I'm not worrying about vaccine, but it's the time to give vaccine. 2 months is too young. So, okay, so it is not against immunization, it is not against vaccine, it's a specific problem for the time of immunization. And it's very interesting because I have no time to share all the video of all the interventions. The intervention took 25 minutes, but during the intervention, making confidence with the parents, after 10 to 15 minutes, the mother said to me, okay, my real concern is because vaccines could make fever for my babies, and my first babies has a cardiac malformation. So doctors said me that it's very dangerous for my babies to have fever. So this mother was afraid of fever, and it was not really concerned about the age to give the vaccine, but she was concerned about fever. And when we could give all the information about fever, vaccine, it was done. And at the end of the intervention, mothers, I don't ask the mother what we're going to do, but she spontaneously, she said to me, okay, next month I have an appointment for my 2-year-old son. And during this time, I will take my appointment for the week now. So she changed her mind and she took her decision. And I never asked her what you are going to do. And so it's very important to be large at the beginning, to not judge people, and to focus progressively on the main concern of the people.
That's definitely an interesting story. So the next question was, will this motivational interviewing intervention be offered during the perinatal period as well?
It's a really good question, because at the beginning, I was asking myself, should we do that in the prenatal period or just after birth in maternity wards? I don't have data on a prenatal period. I saw that some teams in the world are trying to make that. For example, in Australia, they have a prenatal program that works well. For the implementation of the ME program, we have a reflection with the Ministry of Health if we should implement the ME program also in prenatal period. And we have decided to stay in maternity wards because, according to logistical reason, in all the provinces of Quebec, the maternity wards are organized in the same way. So it's very easy to starting a program when every unit works in the same way. But for the prenatal period, each region has its own program, and each region has its own logistical organization of appointment, etc., etc. So it was very difficult to make a program when there is lots of different systems. So it's why we have not implemented any program in prenatal period. But I think it could be a good way to test it, and I think it could work. At the time, we want to test it for the pertussis vaccination in pregnancy, but we didn't receive funds to test it. But it could be, I think, a good solution. And for example, it could be a good solution for COVID vaccine in pregnancy.
Okay. So I do see here in the Q&A box that we do have quite a few questions coming in. So, and we do have around 5 minutes left for this webinar. So I'll be asking around 1 to 2 questions more. And if you have any other questions, we will definitely forward them over to Arnaud via email, and we will respond to them via email afterwards. So the next question is, a common source of hesitance I encounter is the belief that there are too many antigens given at once to babies and that vaccines are better tolerated given one at a time. Do you have any preferred resources for healthcare workers to turn to help to address these concerns?
Yeah, it's very common. Yes, there is a very interesting literature review. There is an article by Paul Offit who summarize this problem, and it's very well done. And just in a few sentences, it's about the ability of the immune system. Do you know the ability of the immune system to recognize how many antigen in the same time? And the answer is billion of billions. So vaccines, it's only a drop in the ocean of antigen that the immune system could recognize. And also, there is one comparison that makes very often sense for parents. It's all the antigen in the vaccine is less antigen that a baby will face during one day in a daycare center. So 1 day daycare center with all babies, the baby will face with more antigen with all the vaccine, all the antigen contained in the vaccine. So it's not a real problem. And there is also a lot of studies that have demonstrated that to give one antigen by one antigen is not better tolerated than to give antigen at the same time. Of course, we couldn't give 5, 6, or 7 vaccines at the same time. It's not a good thing. But there is scientific studies that have demonstrated that we could receive several antigens at the same time, and it's well tolerated.
Okay, thank you. So I do see that we're running out of time for questions now. So we apologize that we will not be able to get around to answering all of the questions in the Q&A box. However, the CANVax team will forward these questions to Arnaud, and we will respond to them via email. So we would like to thank Arnaud for a wonderful presentation yet again, and thank you to all the participants for coming to this webinar. And please fill out the survey upon closing the webinar window, and we will see you next time in the next CANVax webinar. Thank you and have a wonderful afternoon.